1. A nurse enters a client's room and finds the client unresponsive with no pulse. What is the nurse's immediate priority action? Answer. Begin chest compressions immediately. Rationale. Initiating CPR with chest compressions maintains circulation and oxygenation to vital organs during cardiac arrest, following current BLS guidelines. 2. A nurse is preparing to delegate tasks on a busy surgical unit. Which task is appropriate to delegate to an experienced, unlicensed assistive personnel UAP? Answer. Assist a stable postoperative patient with ambulation. Rationale. UAPs can assist stable patients with activities of daily living, such as ambulation, while the nurse remains responsible for assessment and evaluation. 3. The nurse is caring for 4 clients. Which client should the nurse assess first? 1. A client with a blood pressure of 138/88 mmHg. 2. A client reporting new onset chest pain. 3. A client requesting a sleeping pill. 4. A client with foresight due for assessment. Answer. Assess the client reporting new onset chest pain. Rationale. New onset chest pain may indicate myocardial infarction and requires immediate assessment and intervention to prevent serious complications. 4. A nurse notices that a new graduate is about to administer a medication without verifying the client's identity. What is the most appropriate action by the nurse? Answer. Intervene immediately and review the medication administration rights with the new graduate. Rationale. Ensuring patient safety by confirming the correct patient is a critical step in preventing medication errors and must be reinforced promptly. 5. A client on contact precautions needs assistance with hygiene. How should the nurse minimize the risk of transmission? Answer. Wear gloves and a gown when providing hygiene care. Rationale. Contact precautions require gloves and gown to prevent the spread of organisms through direct and indirect contact with a client or their environment. 6. A nurse is assessing a client's foresight and notes redness, warmth, and swelling. What is the priority action? Answer. Discontinue the 4-line and restart at a different site. Rationale. Signs of phlebitis require immediate removal of the 4 to prevent infection and further complications, such as thrombophlebitis. 7. Which task should the nurse avoid delegating to a UAP? 1. Assisting with feeding. 2. Measuring vital signs. 3. Performing wound dressing changes. 4. Assisting with toileting. Answer. Performing wound dressing changes. Rationale. Wound care requires assessment skills and aseptic technique, which fall within the scope of licensed nursing practice, not UAPs. 8. A nurse is preparing to move a client up in bed. What is the best technique to reduce risk of injury? Answer. Use a friction-reducing device and enlist assistance if needed. Rationale. Using assistive devices and help when moving clients minimizes strain on the nurse's body and reduces injury risk to both the nurse and client. 9. A nurse finds a client who has fallen but is alert and oriented. What is the immediate nursing action? Answer. Assess the client for injuries before moving them. Rationale. Initial assessment ensures the client's condition is stable before repositioning, which is critical to avoid exacerbating potential injuries. 10. During handoff communication, which piece of information is most critical to include? Answer. The client's current vital signs and any significant changes in condition. Rationale. Accurate, up-to-date information about vital signs and condition changes ensures continuity of care and patient safety during transitions. 11. A nurse observes a colleague not washing hands before entering a client's room. What is the most appropriate action? Answer. Remind the colleague to perform hand hygiene before entering. Rationale. Immediate intervention helps prevent healthcare-associated infections and reinforces adherence to infection control practices. 12. A client has just undergone abdominal surgery. Which intervention is a priority to prevent respiratory complications? Answer. Encourage incentive spirometer use and deep breathing exercises. Rationale. Deep breathing and incentive spirometry prevent atelectasis and pneumonia. Common postoperative complications due to impaired ventilation. 13. A nurse is reviewing client care tasks. Which task must the nurse personally perform rather than delegate? Answer. Conduct a comprehensive nursing assessment. Rationale. Nursing assessments involve clinical judgment and are within the scope of practice that cannot be delegated to UAPs or LPNs. 14. The nurse is preparing a sterile field for a dressing change. Which action would contaminate the sterile field? Answer. Reaching over the sterile field. Rationale. Reaching over the sterile field increases the risk of contaminating sterile items, compromising the safety and sterility of the procedure. 15. A client with Clostridium difficile infection is admitted. What personal protective equipment, PPE, is necessary? Answer. Gloves and gown. Rationale. C. Difficile is transmitted via spores. Gloves and gowns are necessary to prevent contamination and limit spread. 16. A nurse is caring for a client with dysphagia. What is the best nursing action to prevent aspiration? Answer. Keep the client in an upright position during and after meals. Rationale. Upright positioning facilitates safer swallowing and reduces the risk of aspiration into the lungs, preventing pneumonia. 17. A nurse notes that a UAP has documented vital signs for the wrong patient. What is the nurse's priority action? Answer. Notify the UAP of the error and correct the documentation immediately. Rationale. Prompt correction of documentation errors maintains accurate patient records, which are essential for safe and effective care delivery. 18. A nurse is assigning tasks for the shift. Which client should the nurse assign to a licensed practical nurse, LPN? Answer. A client requiring routine wound care and medication administration. Rationale. LPNs are trained to perform tasks, such as wound care and medication administration, under the supervision of an RN. 19. A newly admitted client is confused and repeatedly attempts to climb out of bed. What is the nurse's priority intervention? Answer. Implement safety measures, such as a bed alarm and frequent rounding. Rationale. Non-restrictive safety interventions help prevent falls while maintaining the client's dignity and minimizing use of restraints. 20. A nurse is reinforcing teaching with a client about home oxygen therapy. What instruction is most important? Answer. Keep oxygen equipment at least 5 feet away from heat sources. Rationale. Oxygen supports combustion, and keeping equipment away from heat sources reduces the risk of fire hazards in the home environment. 21. A client reports shortness of breath after receiving 4 fluids rapidly. What is the nurse's immediate priority? Answer. Slow the infusion and assess the client's respiratory status. Rationale. Slowing the 4 rate and assessing breathing help prevent worsening fluid overload and guide urgent interventions. 22. A nurse notices that an elderly client's bed is placed in the high position. What should the nurse do first? Answer. Lower the bed to the lowest position. Rationale. Keeping the bed low reduces fall risk, especially for elderly clients who may have impaired mobility and awareness. 23. During a blood transfusion, a client develops chills and back pain. What is the nurse's priority action? Answer. Stop the transfusion immediately. Rationale. These symptoms suggest a transfusion reaction, and stopping the transfusion prevents further exposure to harmful antigens. 24. A nurse is preparing to administer medications through a nasogastric NG tube. What is the first step? Answer. Verify tube placement. Rationale. Ensuring correct placement prevents medication from entering the lungs and causing aspiration or other serious complications. 25. A client receiving oxygen at 2 liters per minute by nasal cannula complains of nasal dryness. What is the nurse's best action? Answer. Apply a water-based lubricant to the nostrils. Rationale. A water-based lubricant relieves dryness without increasing the fire risk associated with petroleum-based products near oxygen. 26. A nurse is caring for a client on seizure precautions. What item must be kept at the bedside? Answer. Suction equipment. Rationale. Having suction equipment ready helps maintain airway patency during or after a seizure when secretions or vomiting may occur. 27. Which action by a nurse requires immediate correction to prevent medication error? Answer: administering medication prepared by another nurse. Rationale: nurses should only administer medications they personally prepare to ensure accuracy and patient safety. 28. A client post-surgery is reluctant to ambulate due to pain. What is the nurse's best action? Answer: administer prescribed analgesic before ambulation. Rationale: managing pain enhances mobility, which is essential for preventing postoperative complications like deep vein thrombosis and pneumonia. 29. A nurse is assisting a client who is weak with transferring from bed to chair. What technique best promotes client safety? Answer: use a gait belt during the transfer. Rationale: a gait belt provides support and reduces the risk of falls or injury during patient transfers. 30. A nurse is documenting care provided to a client. Which statement should the nurse include? Answer: client ambulated 50 feet with minimal assistance and no complaints of pain. Rationale: objective, factual, and measurable information provides a clear, legal, and accurate account of care provided. 31. A client with a latex allergy is scheduled for surgery. What is the nurse's priority action? Answer: notify the surgical team and ensure latex-free equipment is available. Rationale: preventing exposure to latex minimizes the risk of an allergic reaction, which can be life-threatening. 32. When performing oral care on an unconscious client, what is the most important safety measure? Answer: position the client side-lying. Rationale: side-lying position prevents aspiration of oral secretions, protecting the airway in unconscious clients. 33. A nurse is preparing to insert a Foley catheter. What is the first action after gathering supplies? Answer: perform hand hygiene. Rationale: hand hygiene prevents the transmission of microorganisms and reduces the risk of healthcare-associated infections. 34. A nurse finds a client attempting to remove and forecatheter. What is the nurse's first intervention? Answer: gently redirect the client and assess the cause of the behavior. Rationale: addressing the underlying cause helps prevent injury and may resolve agitation without needing restraints. 35. Which situation requires the nurse to complete an incident report? Answer: a client was given the wrong medication but experienced no harm. Rationale: all medication errors, regardless of patient harm, require documentation through an incident report to improve safety systems. 36. A nurse notices that a sterile dressing tray was opened 30 minutes before use. What should the nurse do? Answer: obtain a new sterile tray. Rationale: sterile fields become contaminated over time. If left unattended, a new sterile setup must be used to maintain asepsis. 37. A client with impaired vision asks for assistance to the bathroom. What is the safest way for the nurse to assist? Answer: allow the client to hold onto the nurse's arm while walking slightly ahead. Rationale: guiding the client in this manner promotes safe mobility and independence while minimizing risk of falls. 38. During medication administration, a client questions a pill's appearance. What is the nurse's best response? Answer: recheck the medication against the provider's prescription before administering. Rationale: verifying the medication ensures accuracy and builds trust while preventing potential medication errors. 39. A nurse caring for a client with an indwelling urinary catheter observes no urine output for 6 hours. What is the priority action? Answer: assess the catheter and tubing for kinks or obstruction. Rationale: mechanical obstruction is a common, easily correctable cause of reduced urine output before considering more serious issues. 40. A client receiving enteral feedings via gastrostomy tube develops diarrhea. What is the nurse's first action? Answer: slow the feeding rate and assess the client's tolerance. Rationale: rapid administration may overwhelm the gut, causing diarrhea. Adjusting the rate and assessing helps improve tolerance. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.